Hello, my name is Dr. Ben Sessa. I'm a consultant child and adolescent psychiatrist, and I'm a trained and registered ketamine psychotherapist, MDMA psychotherapist, and psilocybin psychotherapist. It's a great pleasure to be providing this e-presentation to the Oxford Ketamine Conference this year in 2022, and I'm looking forward to attending the conference in person on the 5th of April. In the meantime, I'm going to talk briefly about the concept of ketamine-assisted psychotherapy, and it's a great pleasure that we have this particular topic on the programme at the Oxford Conference this year. So we're going to start with some history around ketamine, really as an anaesthetic and its use in psychospiritual circles, and as a recreational drug. And then we'll talk about how ketamine emerged for psychiatric indications, initially as an antidepressant, and how we're now moving forward using ketamine as an adjunct to psychotherapy for broader psychiatric indications than just treatment-resistant depression. And I'll finish with a few words about our service that we're currently providing for patients with a range of psychiatric disorders using ketamine-assisted psychotherapy. So as we know, ketamine was developed as an anaesthetic in the 60s. I'm not going to read out all of this slide, but it's fair to say that what we're demonstrating here is that ketamine emerged from a precursor of anaesthetic phencyclidine, PCP, which was first developed in the 20s and used in the 50s, but PCP was very long-acting, so ketamine was designed in the 60s to be a shorter-acting, more manageable anaesthetic, and indeed it was used throughout the 60s and 70s in human medicine as well as in veterinary medicine, and it became particularly important in combat medicine, where it was used in the field in Vietnam as a short-acting dissociative anaesthetic, and very useful for those people in that arena. Ketamine began to emerge in the psychospiritual circles in the 1970s, and there's two notable names here. Marcia Moore is one, another is John Lilly, who used ketamine as a psychospiritual tool. And again in the 80s, this was picked up again and started to emerge in those areas. Now, ketamine did not play a great deal of attention in the 1960s drug recreational scene, but it certainly began appearing in the 1980s, and particularly by the 90s it was being used throughout Asia and particularly in Hong Kong, and then in the 2000s it began to come into the United Kingdom, and it's an interesting drug in the recreational rave scene in that it's not a particularly dancey drug, being an anaesthetic. Often people will combine it with other stimulant drugs such as cocaine or MDMA, and as we know as clinicians, we've probably met a lot of patients who will describe accidentally consuming ketamine when they insufflate a line of white powder which they believe to be cocaine, and they get quite an interesting surprise when it turns out to be ketamine. So it's very well embedded within the rave scene and within recreational use. Now, in order for us to understand ketamine's role in psychiatric indications, we actually need to go right back to the early 1990s, when Evgeny Krupitsky, a Russian psychiatrist, was using ketamine-assisted psychotherapy years ahead of the pack to treat addictions, particularly opiate and alcohol addictions, and hundreds and hundreds of cases in which he used this with very good results, using ketamine as an adjunct to psychotherapy. Then in the early 2000s, the serendipitous discovery was made that ketamine had antidepressant effects. And then throughout the early 2000s and into the 2010s, we started to see the emergence of ketamine infusion clinics in which, without psychotherapy, ketamine was used as a short-acting antidepressant, and it gained a lot of popularity in this way. And then as we go into the 2010s, we start to see the emergence of ketamine-assisted psychotherapy. Raquel Bennett in San Francisco and Phil Wolfson were also big pioneers in this field. And we start to see also some small pilot studies broadening the psychiatric diagnoses away from just ketamine as an antidepressant towards ketamine as an adjunct to psychotherapy for a wider range of disorders, including anxiety disorders, PTSD, and addictions. And in 2016, Professor Celia Morgan of Awaken Life Sciences started the CARE study, which was the world's first randomized control placebo study to look at ketamine-assisted psychotherapy for the treatment of alcoholism. And then as we get into 2020 and beyond, we see the emergence of dedicated clinics providing ketamine-assisted psychotherapy, initially Field Trip, who opened clinics in the United States and Canada, and in 2021 the opening of the Awaken Life Sciences clinic in Bristol, with further clinics on their way. Now, in terms of the clinical indications for ketamine-assisted psychotherapy, what we do at Awaken Clinics is we are not a ketamine infusion clinic just using ketamine as an antidepressant for the treatment of depression or TRD. Rather, we're broadening the psychiatric diagnoses by using ketamine as an adjunct to psychotherapy for a much wider range, including bipolar disorder in the depressive phase, anxiety disorders, PTSD, substance use disorders of all kinds, and eating disorders. And there are small amounts of pilot research that demonstrate the safety and efficacy of ketamine-assisted psychotherapy for these broader psychiatric indications. Now, how does ketamine-assisted psychotherapy work? Well, it's really a combination of different factors. As we know, ketamine has this neurogenesis effect, this neuroplasticity, neuroflexibility effect, which is a result of the neuron proliferation and growth. And what we do is we combine this with the psychological experience, the supportive psychotherapy, in order to help the patient to hone these biological changes into an enhanced psychological flexibility, which can help patients with stuckness and rigidity in their thoughts and behaviors. So there's really three different arms or activities that are going on simultaneously with ketamine-assisted therapy. As we said, there is a purely biochemical effect, and this is the neurogenesis and the neuroplasticity that arises as a result of ketamine. This is obviously a strictly medical paradigm in which the patient takes a passive role, and the nerve growth is going on without any intervention from psychologists. However, is this the optimal way to use the ketamine experience? We feel not. So we move on to the psychological relationship that's going on in ketamine-assisted psychotherapy. And this can occur at lower doses of ketamine, so doses up to approximately 0.7 milligrams per kilogram intramuscularly. And here, ketamine can be seen as a psycholytic drug. So we're not looking for a full psychedelic or mystical experience, but rather a sense of lubrication, a sense of disinhibition, and in combination with psychotherapy and a trusting, containing relationship between the patient and the psychotherapist, the patient is actively participating in getting well by using the ketamine experiences at a lower dose without dissociation or psychedelic effects to tackle rigid narratives that so often underpin chronic mental disorders, especially addictions. Now, as we move up the dose, so dose ranges above 0.7 milligrams per kilogram intramuscularly, we start to move into the mystical, spiritual, dissociative or psychedelic type experience. Now, this experience is very easily manageable in a clinical setting. It's relatively short-acting. Most patients are back to baseline within 60 to 90 minutes. And during the actual psychedelic experience, the patient very rarely does any actual talk therapy. Rather, the talk therapy comes before, during preparation sessions, and afterwards in integration sessions. During a full dissociative or psychedelic experience, the patient tends to be what we call inside, wearing headphones and eye shades and being with the drug experience. And then later, we do the integration work to discuss the material that emerged for the patient in their drug experience. So this slide says pretty much the same thing, that there are kind of two different sorts of uses of ketamine in this dose-dependent way. In the lower ranges, 10 to 50 milligrams, we have this enhanced communication and reduction of fear and the possibility for the patient to do some talk therapy in this psycholytic state. And then at the higher doses, a transformational state or a psychospiritual psychedelic state or a dissociative state, and these are the higher ranges, 50 to 100 milligrams and above. What we get is complete loss of body and sensory awareness, and this, in combination with integration sessions, allows this enhanced capacity for openness and creativity. And honing this work with the psychotherapist and an increase in mindfulness, it provides us an opportunity for the patient to look at new ways of their problems and move forward with positive behavior change and improvements. So, as we know, trauma underpins most, if not all, chronic mental disorders around affective and anxiety states, and certainly PTSD and addictions. And the degree of trauma is being balanced here alongside the therapeutic alliance of the patient and the dose of the ketamine. And as I've said, we can have some flexibility in the dose of the ketamine to provide the most positive, beneficial experience for the patient. Now, we can talk about the ketamine-assisted psychotherapy signature, and this is work of Dore et al. In 2019. And again, we have a combination of the pharmacology of the drug. It's a rapid onset drug with rapid metabolism. This makes it very clinically manageable, especially with the intramuscular dosage. And the effects are very dose dependent, from a psycholytic loosening effect at the lower doses right up to a complete loss of sensory awareness at the higher dissociative doses. And in this higher dissociative dose, we experience the typical effects of a psychedelic experience, including an ego dissolution, a sense of out-of-bodiness with boundaries of space and time distorted. And these provide an excellent platform for the patient to tackle rigid and narratives that often underpin chronic mental disorders. And the other good thing about working with ketamine is we know it's so very safe. It's the anaesthetic of choice in children and the elderly because of its very low toxicity profile. So this makes it a very manageable drug clinically. Now, the integration work is so important, and this is what takes place in the non-drug sessions after the ketamine experience. And this is where the patient will use the material gained in the drug session to tackle rigid narratives. So whilst we have the biological effects going on and the neurogenesis and the neuroplasticity from the biological effects of the ketamine, we hone the psychotherapy to start looking at trauma in a new way, to start enhancing the psychological flexibility of the patient. And this is a very highly skilled process which requires a lot of support and attention as well as preparation on the part of the psychedelic therapist. And in this trusting relationship, the patient is able to reduce their negativity and increase and enhance their creativity and move towards new versions of themselves in which they reduce negative narcissism and self-obsession and can use these psychological changes towards positive behavior change. Now, at Awaken Life Sciences, we're very keen on an individualized treatment in which patients are at the center of their care plans. Patients can decide dose ranges over the course of their 4 ketamine sessions. We aim to move most patients towards the dissociative state at whatever dose that is for them, in order for them to have the maximum effect of this enhanced flexibility which is being induced at a biological level, and we're honing the psychotherapy to produce psychological flexibility as well. And it's very important that patients have this focus on them at the center of their care plans in order to empower them and improve outcomes. And we monitor outcomes carefully, both pre and post ketamine-assisted psychotherapy courses, in order to help the patient to move forward and in order to develop new protocols for our service. So there's many different sorts of ketamine-assisted psychotherapy protocols, and the one I'm outlining here is the Awaken Life Sciences 8-week KAP course. But the most important aspect of this is, as with all psychedelic protocols, it's a combination of both drug sessions and non-drug sessions, and those drug sessions are essential. So at Awaken Life Sciences, we will never be providing just infused ketamine without psychotherapy. We believe that's missing a trick. We believe the psychedelic state is not just an irritating side effect that the patient has to endure, but rather this material is valuable, and in combination with psychotherapy, we can help the patient move forward further than simply using ketamine as an antidepressant. So we have a combination of drug and non-drug sessions. And this is how we would also use MDMA and psilocybin. Myself and the rest of the team at Awaken Life Sciences were initially trained in MDMA and psilocybin-assisted psychotherapy, and we're now using ketamine as a similar adjunctive tool. So in this 8-week course, firstly, the patient has an initial medical assessment in which a senior doctor will assess inclusion and exclusion criteria, MHRA, guidelines on off-label prescribing, because as we know, racemic ketamine does not have a license for psychiatric indications, but it can be used for psychiatric indications off-label as long as those guidelines are adhered to. So a senior doctor carries out the initial medical assessment, looking at physical health, risk issues, and eligibility for the course. They then enter the 8-week course. The first week are 2 sessions of non-drug preparation in which to build up a therapeutic relationship with the patient and to develop an agenda for the kind of issues we wish to explore in the psychotherapy. Then in weeks 2, 3, 4 and 5, the patient has a weekly session with intramuscular ketamine, and as I've said, this dose can be altered in collaboration between the clinician and the patient in order to move the patient towards the most effective dissociative dose. And each week, after each ketamine session, within that same week, there is a non-drug integration session, which is so important to unpackage the material that came out in the drug session that week. Then there's a 2-week break, and then in week 8, the patient returns for a final non-drug psychotherapy session in which outcome measures, which were initially collected at the initial medical assessment, are then repeated in order for us to demonstrate safety and efficacy of the KAP course. Now, at Awaken Life Sciences, we have our fingers in many pies. We are not only researching and developing psychedelic medicines, but we're also delivering them through clinics. Now, at the research and development and exploration phase, we are also training psychedelic therapists, and we provide online teaching modules and in-person lecture courses to train clinicians to become psychedelic therapists with ketamine and other psychedelic medicines. At the moment, our training is restricted to people who are coming into our service as employees, although we do hope to roll this out more widely in due course. We're also working to develop ecosystems and digital developments, including wearable technologies and patient feedback, which allows us to fine-tune our treatment protocols and move the courses forward accordingly. And we're carrying out a raft of psychedelic research, including taking the recent Bristol MDMA for alcoholism study forward into phase 2B and eventually phase 3, with a final goal of seeing MDMA for alcohol use disorder licensed as a treatment. Our Professor Celia Morgan's phase 2B ketamine for alcoholism study is now moving into phase 3 with an eventual plan to see ketamine licensed for this indication. And we're also, under Professor Celia Morgan, carrying out research into behavioral disorders, including gambling and pornography addictions, using ketamine-assisted psychotherapy. Another part of our research is the development of new entactogen molecules, so these are new chemical entities, to provide more clinically meaningful treatments in the future with other psychedelic molecules. And the delivery part of what we do at Awaken Life Sciences includes the actual physical bricks and mortar clinics. We now have 3 clinics open in the UK and Europe, including Bristol, Oslo and London, with further clinics including Manchester, Dublin and Edinburgh, etc., coming in the next few years, with a plan to open 15 to 20 clinics throughout the UK in the next 4 or 5 years. And that small table at the top there demonstrates our portfolio of research plans going forward. So thank you very much for listening to the presentation. I look forward to joining you in Oxford on the 5th of April. In the meantime, thanks for your attention. I hope you enjoyed the show.